Welcome, everybody. Thank you so much for joining us. My name is Greg Evans. I'm the sales specialist for sports medicine. I'm thanking you for returning to our newest installment of sports medicine presentation. So today, I'm going to be going over emergency sideline and some important things that are that I feel like every athletic trainer should consider when it comes to putting in your emergency sideline bag. For those of you guys who are returning, welcome back. For those of you who are new, thank you for joining us. As I mentioned, I am the sales specialist for sports medicine. I'm an athletic trainer. I've been an athletic trainer for over 25 years. I spent 20 years in the college setting, and in the last 5 to 6 years, I've been here at School Health. My primary responsibility is finding new products and keeping us up to date on what's new issues in sports medicine, and then also educating our sales staff and our product teams about how do we present these to our customers, to you, our end users, the athletic trainers. So I get to travel around the country. I'm showing product, but I learn a lot of things from you. So what I'm presenting to you today is our products that we've discovered through our vendors, but then also a lot of valuable information that I've learned from you, athletic trainers out in the field. So let me go ahead and get this, get the PowerPoint going, and for you guys to see a little bit more of it. Okay, so the first thing I want to talk about when we go to the sideline kit is we're going to talk about the sideline emergency bag. I've already given a presentation in the past about choosing the right athletic training kit for you, and I'm not going to go too deep into the bags and show you different bags. I just kind of give some highlights about these bags. And so when you're thinking about your bag that you're going to carry your emergency supplies in, think about something that has high visibility, it's easy to spot, easy to call for. Hey, bring me the yellow bag, bring me the red bag. Something that anybody whether they're a part of your staff or whether they're support, they just know what bag you're talking about and they can identify it easily and bring it to you if you're having to do some on-field management. The other thing to think about is you want this to be a robust bag that is really good for maybe outdoor protection. So whether it's water resistant or waterproof, it's got good cushioning inside so that it can protect any valuable instruments or products that you have in there. And then the other thing is you want it to be very organizable, have capabilities that you can keep it well organized, you can have it labeled, and you know exactly where everything is so that when you go to that bag, whatever specific emergency you're dealing with, you can find those items very, very easily. When we think about the contents, I'm not going to go over a detailed list of every single thing you should have in there. I'm just going to be highlighting on some specific products that I think you should consider. But some of the things to consider, and this is from learning from experience and then seeing what athletic trainers are using, is you want to have some items for diagnostics, whether it's a BP cuff, stethoscope, a pulse oximeter, anything to that level. Thinking about your ABCs, airway, breathing, circulation, you want to have stuff for airway management. So your airways, whether it's maybe a nasal pharyngeal, an oral pharyngeal airways, or if you have even advanced training, some other airways that can go through the throat. And then also bag valve mask, using the ability to deliver oxygen effectively, specifically in an emergency situation. For cardiac care, I'm talking about AEDs and any other types of products that will allow you to give good and effective CPR, and also the follow-up needed care with advanced life support and with an AED. Today, in this day and age, we really need to consider about bleeding control, the possibility of stop the bleed or any of those types of products to be a part of it. And then going on further is spinal cord management, whether it's a cervical collar, anything that's going to help you stabilize an athlete that has a potential head and neck injury. And then going down into splinting, whether it's mechanical splints, whether a vacuum splint, or even simple splints as a sling or triangular bandages. These are some of the things to consider that's in an emergency bag. And you might have a bigger list than what I've just stated here, but this is just a general idea to get you started thinking about your emergency bag. Now, I told you I wasn't going to talk too much about bags, but I did want to point out these bags here. This is the Mueller Merit bags. These are two different ones. One is the Mule, which is a little bit larger. It actually is on wheels, has a bit capability of being a backpack as well. It has different modules you can add to the side. And then also, the thing I like about it is that this Mueller Merit bag was designed by an EMS company. So it has the ability of holding all those emergency supplies I talk about, has some great labeling options and great organization. The other bag is the Merit Omni bag, which is a little bit smaller, but again, has the capability of adding extra pouches. You can even add a pouch that would allow you to carry an oxygen tank if that is something that you wanted to embrace. All right, so let's go ahead and start talking about a little bit more of the specific products that I was telling you that I think you should consider for this. So the first one, let's just start with some diagnostics. And the one diagnostic piece I wanted to highlight today is a pulse oximeter. I think a lot of athletic trainers and sports medicine professionals are realizing the importance of knowing a good oxygen saturation level when you're dealing with your athletes, particularly in an emergency situation. And there's many different pulse oximeters out there. So today I'm going to talk about the MightyStat, and this is from a company called Masimo. And I call this one I'm showing you particularly, I call it the kind of the Cadillac of pulse oximeters. And so it does have a little bit of a higher price range, but there's a reason why it is at this type of range. It's a very durable one, easily displayed that you can see, and it definitely gives some really good, accurate details. You can give your heart rate, your breathing rate, of course, your oxygen saturation, and then they also offer the PVI, which is the Pleth Variable Index, and it's a different mixture of checking the fluid intake, the oxygen saturation with other factors come in, gives you the PVI. This is really good for you helping to determine the hydration level of your athlete. And so basically, the lower the level, the better their hydration is. The higher the level, the less hydration there is. And so putting this on and checking and monitoring their PVI, you can even see the level of hydration that your athlete might be at. So I'm going to go ahead and pause the PowerPoint for just a moment so that you can get a little bit of a closer view of this. So this is the MightyStat, and this is actually on my hand right now. Hopefully you can see that. I'm going to try to hold it in such a way that you can see the display pretty good. And even in the brighter sunlight, you can see this very well. The one thing that I really like about it, that this is Bluetooth capable. So imagine you're treating your athlete, you put this on them, you're going to get their breathing rate, you're going to get their pulse rate and their O2 levels, and then also you can monitor it on your cell phone. And so it's one of those things that if you have the athlete, you're monitoring them, and while you want to see that they're getting better, you can set them off to the side and make sure they're good and comfortable, and then you can be monitoring their rates from a distance away from them. So you don't have to stay on top of them or constantly looking to what's going on their finger, that you can follow with their phone. And I think that is a great option for you to consider when it is using for a oximeter for your athletes there. So going back to the PowerPoint, let's move on to some of the other products that I think are very valuable for you to continue to think about. So the next one I'm going to talk about is for when we're talking about for your airway management is a bag valve mask. I believe these are very, very crucial when it comes to taking care of an athlete and you want to get proper ventilations, whether you're doing CPR, helping with rescue breathing or anything like that. And having a bag valve mask is very vital to have about it. But the one thing that I want to show about the Pocket BVM, this is a great product that we've had some tremendous response from athletic trainers, and it's the compactability of it there. So I'm going to go ahead and stop the PowerPoint for a moment just to get you a close-up to see what this is. So this is the Pocket BVM. So seeing how it is in my hand, it's really nice that this is a full-size adult bag valve mask. So we opened it up. It comes with a mask. It has an oxygen port, has the ability for you to connect, and you can just do your regular venulations with it. And so it's very compact. Also know that even though it comes with a face mask, this port is universal. And so let's say you carry your own CPR mask. So this is a completely different brand mask. Because of the universal, this one will fit inside of it, and you can use whatever mask you want. But this is just a great compact mask that you can keep, that stores very easily in your kit, and just know that this is the space that it takes up, and it's very, very durable to use. So that is called the Pocket BBM, and great success that we've had out in the field with this product. Okay, going back to the PowerPoint, let's take it a little bit deeper. So now that, let's say we're taking for our airway management, let's go to the next level and let's talk about AEDs. There is so many AEDs out there, and your school might already have one that you've already chosen to use. But if you're looking for something that maybe is a little bit more compact, that is for the needs that you have for your program, then I would consider you consider the Heart Sign. Heart Sign Samaritan, this is the 450. Some great things about this is that this is designed for compact use. And so it is only weighs, less than 3 pounds, 2.4 pounds. It's got the highest level of protection against dust and water. And just like any AED, it's got a lot of easy verbal guides to follow. And this has a very relatively low cost of ownership to have. And so one thing that's really great about it is when you pull it out, the pads just are right in here. These are for adult pads right there. They have 4 years, and the pads and the batteries are replaced at the same time. And for 4 years, that's a really good capacity for replacing pads compared to other AEDs that are out in the market. So one thing I did want to show you is that it is, again, I wanted to show you in reference to myself about how small it is, and still it's an effective AED that's going to deliver the right shock that you need to take care of for any cardiac conditions you might deal with out on the field. So again, the Heart Sign Samaritan, great compact, and as you can see that this would fit really nicely into a pocket on an emergency bag when you needed to go there. Okay, so the next one I want to talk about is Stop the Bleed. There are many, this is a new area that I know that a lot of people get nervous upon when you think about Stop the Bleed, but just knowing this, you're an athletic trainer, and if an emergency situation happens out on the field, it could be an injury of an athlete, or it could even be something that's out of your control, active shooter, mass casualty, whatever it is. Whether you think you're a first responder or not, people are going to look to you to be a first responder. And so I implore you that if there's any opportunities you have to take Stop the Bleed courses, learn more about how to deal with mass casualties, I think it'll give you safe peace of mind, but also make you more effective in your abilities to do so. So one of the Stop the Bleed kits I wanted to kind of highlight is the STAR kit. This is actually a kit that we partnered with H&H that they make for us. And this is everything you need for a Stop the Bleed mass casualty event. So we got a CAT Generation 7 tourniquet, a SWAT T tourniquet, tack gauze, chest seals, 2 of them, quick clock dressing for image control, and then a hypothermic blanket for controlling shock. So everything is in this nice compact piece. And I like this is that it's just a one-stop shop. You just buy it, you have a special spot in it into your bag, and then when an emergency arises, you can pull it out, dump the contents, and you have everything that you need in a major bleed situation. So this is called the STAR kit in the School Health brand. Okay, another unique one, product to talk about is for cervical collar for stabilizing the spine in an emergency situation. And again, it's all about being compact and being proficient in what you're doing. So we ran across this product a couple of years ago, and this is called the Air Cervical Collar. And I'm going to go ahead and switch over so that you can see me more directly there. So this air cervical collar was developed by backcountry EMS. So this is like ski patrol, wilderness EMS, and what they wanted and needed is a cervical collar that's compact, that travels very easily, but is very effective about stabilizing the cervical spine. And so this is it sealed up, and then here it is when you pull it out. And so it's a puncture resistant, heavy duty, latex free nylon that it's very flexible, and it's a one size fits all as far as for an adult. So I'm going to show you a quick demo here. I have my good old trusty mannequin here, and I'm going to show you the best way, hopefully possible, for you to see how this would fit on. So it's really simple. You just place their chin where it says place chin here. I hold on to the side here. I like to put it so that it is snug around their neck and it attaches. That's how you size it, okay? Now, I'll make sure that this lines up here pretty well, okay? And then obviously with a real person, it conforms a little bit better, but as you pump it up, the baffles fill and they help to go and support the neck, the cervical spine. Now, big question everybody asks, you know, isn't this going to cut off circulation to their neck? No, the baffles are designed perfectly so that it gives the structure that it needs to support the spine, but does not occlude any vessels to the neck. So this is not occluding any blood going to it. You have the open area that if EMS needs to do more advanced work with the trach, they can. And it is a very nice fitting piece. Some of the anecdotal things I've heard, especially from those in the EMS world that have utilized this, is they like how compact it is. They like how easy it is to apply. And then also they found that their patients are more compliant wearing this than a traditional stiff neck. That you know, a lot of times when they're putting this on somebody, it's somebody who's maybe lethargic, has had maybe a head injury, and when they put this on them, they find it to be less combative by using this this product there. But the most proficient thing that I really like about it is how compact it is. And they did a study on this, and they showed that this to be just as effective about stabilizing the neck as a stiff neck or other more rigid cervical collars out there. And again, this is called the Air Cervical Collar. All right, let me go a little bit more talking about some products. Now, first I just talked about cervical spine. So let's talk about more advanced splitting. So let me go up here, get back to the PowerPoint. And so I'm going to talk about some vacuum splits that are available. So vacuum splits have been out for many, many years. Most common one that I'm sure that a lot of you guys are familiar with are the Kramer vacuum splits. They're great vacuum splits. I've used them for many years. But I want to show you maybe a new product that maybe you haven't considered. Hartwell vacuum splits have been around the market for quite a while. This is the #1 vacuum split used by EMS in the country. And so I'm going to show you two different types. So the very first one I'm going to show you is the vacuum split. And so what I would say comparison for product to product between maybe the Kramer vacuum splits that you're already familiar with and this vacuum split, they're very, very similar. The same type of heavy duty nylon that you would see, the same type of valve that you would have, closure of doing it. But the one difference where I want to talk about the difference between the two is that this one, as being one of the #1 used by EMS, is that if you're using this, when EMS rolls up, most likely they are knowing what you're using. And you don't have to explain the brand that you're using or what you're trying to use. This might even be the split that they carry themselves, okay? And then also, it's very versatile in doing it. So I'm gonna go ahead and stop the PowerPoint for a moment, just you guys to get a little bit closer look to it. So as I mentioned, compared to the Kramer, it's very, very similar. Now this is a medium. They actually have a large, which is several inches longer, and then they have a small, which is considerably smaller than this. And between those three sizes, you will be able to splint all the appendages that you need on your field. And so it works out really well. One thing that I like about it is they really have some really nice, just even simple strap management, just keeping the straps from flapping everywhere that you can do them. But just like your traditional splints that are out there, it's a quick connect. And the thing I like about it is it's a dual pump that it doesn't take much to deflate it. And then once you do so, it becomes your heavy duty rigid splint, just like you would like. And you can splint them in the position you find them. One thing that's really nice about this one is that it's got a quick release that you don't need the pump to reinflate it. All you have to do is push the valve and you can take it off there. So you can put this on your athlete, send them to the EMS, you get to keep your pump, and it's an effective splint there. And so this is an affordable splint. This comes in with 3 sizes and a bag and a pump. It is in the $675 range. I think that is a great price. It's far less expensive than the same equivalent set of the Kramer bags. And I think you'll find it a great splint for your field. But if you're also looking for economy, I want to show you a new splint that from the same company that I'd like for you to consider. And so this one is called the Fast Splints. All right. So same company, and this is kind of a little bit more of an economical version, and they call it the semi-disposable. And when I want to be careful about when we say the word semi-disposable, we don't mean semi-disposable as you just use it once and throw it away. What they're saying is that this is so less expensive. In the EMS world, what they do is they use these, they put it on their patients, and then they don't expect them back because of the low cost, and it's easy to replace. So let me take you through some of the details of this splint. All right, so one that you'll really like, minimal replacement cost. It has a easy, clean, reusable plastic covering. And so how they usually save some money on it is the plastic is less expensive than nylon. They don't have any straps that comes with it. And I'll show you, get you a little bit closer to the picture here so you can see it. All right, so it's kind of funny. As an athletic trainer, you'd appreciate it. They have a little picture right here that says you must use a roll of tape to secure this on. The last I knew, we kind of carry a few rolls with us, so this shouldn't be an issue when we put it on our patients. But again, just like any splint, it has the ability to conform. So imagine you put this around someone's arm. It has a different valve that you still use the same type of pump. Okay, you reduce all the air out of it. You basically secure it down by pushing the valve down and reviewing the pump. And then now you have your rigid splint, as we just talked about. And then once you release it, all you have to do is pull up on this valve, and that allows the air to go back in. So again, they use the same die cut. This is a medium. They have a large and a small. All 3 sizes will take care of the appendages you need. But the really great price about the thing about this is it's half the cost. And so for $300, you can get splints that are available there. So imagine if I think you need to have multiple bags. And so this is a very affordable set that you can maybe buy 3 at a time. You have the ones that go out to football, the other set that goes out to soccer, the other set that stays near the athletic trainer. So you're not breaking your budget by getting you the multiple splints you need to take care of the multiple sites that you have to cover. So again, those are the vacuum splints that are out there. All right. So I'm going to go back to the PowerPoint here and finish a wrap up on what we're talking about here. Okay. So back here. All right. So here's my summary of what we're going to be talking about here with the emergency kits. Everything is variable to what your specific needs are. Part of it is the training that you have that you feel comfortable doing. It might be the municipality that you live in. You can live in an area where you have quick, fast EMS response times that maybe you don't need a lot of equipment. You just need the basics to take care of important things until EMS arrives. But also many of you guys are probably maybe in rural areas in which you are responsible for quite a bit of time until EMS arrives. So the application really varies to whatever setting you're in. Also, you think about your personal preference. You might want, the heavy duty nylon compared to the plastic, whatever it might be. And also, as I mentioned, to your level of training out there. And then of course, always budget. Budget is always out there. And so just because you might have a lighter budget compared to somebody who maybe has a robust budget, you can still get the emergency supplies you need so that you can feel secure in the athletes that you need to take care of. So I want to leave it open to some questions. I know that there's been some questions that have kind of popped up while we've been talking there. So I'm going to kind of go back and see if there are any questions. Ryan, Ryan, my moderator, can you give me any questions that people might have had?
Hi, Greg. Yeah, we do have some questions that have come in while we've been talking, and it looks like we've got about 4 minutes left here in the session. So let me get a couple of these questions over to you. First of all, we have a question here about the Hartzine AED that you showed. Does that have options for pediatric pads?
Yes. So the one I just showed you has the adult version, but for you can get peds that can slip into the same bag with it, that just snap in and snap out without any problems at all.
Okay, great. Thank you, Greg. Talking about the vacuum splints, I think that you were mentioning that those were coming in a bulk package. If someone's using an individual vacuum splint and wants to make sure that they are replenishing their stock, can those be purchased individually?
Yes, they can, whether, let's say you have one that gets damaged, they can easily replace them whatever size you want. Or specifically, if you're thinking about the fast splint, the semi-disposable, that you might have your walking wounded, you have a visiting team, and you send the splint back with them, and you don't get it back. It's very low cost just to replace that one piece. You don't have to replace the whole set.
Okay.
Do we have any time for any more questions, or should we wrap up?
Yeah, I've got a couple more here, and it looks like we're still just a couple minutes out. So. Talking about the Mighty Sat, we've got a question here about the different options for the Mighty Sat that I believe it was a pulse oxygen monitor.
Yeah, so the one I've shown you is the Lux. And what separates this one from the others is that PVI, that you can check out their hydration levels with it and their breathing rate. Because of that PVI. The PVI helps generate the breathing rate that you're wanting to get out there. If you're wanting just a general use, heart rate and blood saturation, they have a level that's like half the cost, but still Bluetooth capable. That's one to maybe consider if that's out there. And again, getting to know the oxygen saturation is very, very important when it comes to dealing with that. So that's something that it's an option there. So again, about half the cost, and you just really don't have the capability of the hydration and the breathing rate. So consider there.
Okay, great information. Thank you. Let's do one more question here. You mentioned the School Health Stop the Bleed kit, and
yes.
we've someone asking if those are available in bulk quantities for their school.
Yeah, we sell these individually, but also I believe we have a bulk rate of 10 or more. I don't have that pricing off the top of my head, but just like anything, we want to work with you. So if you have some questions and what your budget allows you to do, we can come alongside you and find the right mix that you need so that it could be affordable for your program, whether it's for your individual need, for your sideline kit, or whether you're even maybe taking care of your whole department or even school setting. So that's a very good question, but yes, it's out there.
Okay, perfect. Thank you, Greg. It looks like we are about at time, so I'll let you go ahead and get wrapped up. If you have submitted a question and we did not have a chance to answer it, just know that we will reach out to you directly with an answer to your question if we weren't able to get to it here during the session.
Great. Thank you, Ryan, for bringing those to me. Just want to close thanking you for your time. Just wanted to let you know that this was been very fun to learn from, And I want to learn from you. We get better as a company hearing back from customers such as yourself. So anytime, if you have any questions that we can help answer for you, please send them in. And if there's anything that we can answer back to you, please let us know how we can help you. Thank you so much for your time. Stay safe out there, and I look forward to seeing you the next time we have a presentation.